I am declaring a provincial state of emergency to support our provincial health officer and Minister of Health in swift and powerful response to the COVID-19 pandemic.
I am issuing a new order effective today. I'm now ordering that personal service establishments must close until further notice.
In March 2020, there were a lot of things going through my mind.
Today, under the direction of the Provincial Health Officer, we are directing all schools to immediately suspend in-class instruction until further notice.
We had just come back from the United States. I had taken my kids to California, and we came back January 10th. And as soon as we got back, my son was very sick. During that time, I remember watching the news and what was happening in China, and it dawned on me that this could be something really big. This could be a pandemic worse than SARS.
COVID-19 may be the biggest challenge our province has ever faced it. So tonight, I'm extending BC's state of emergency so we can continue taking measures to keep people safe.
March 2020, when COVID hit, at Island Connect Ed, really we thought that we would just be closing down our doors for a few weeks, and that we'd make it safe for all of our families, and that we'd be opening back up and everything would be back to normal by the summer. That was our hope. We realized that we were the only option for anybody that wanted to stay home. So every family in our district that chose not to go back to school chose Island Connect Ed. And our school population for K-7 rose from 120 to 750 in a few months.
I think it's been really challenging. I have seen for some kids who, already had kind of school anxiety, like being at home was actually really lovely for them, and it was kind of like a relief from the stress of being in the school environment. And then for other kids, just awful because they're isolated, they're away from their friends, they don't know when they're going to see them again. Families are worried about work and paying the bills. Teachers are worried about, how do I learn this new technology? How do I, meet the needs of all the kids? How do I cope with, going back into unsafe, working environments?
When the pandemic began in March 2020, I was a kindergarten teacher, teaching our youngest learners at Oak Lake Community School in Manitoba. And on March 13th, Manitoba schools closed, and I said goodbye to my little ones. And that was the last time that we ever gathered as a classroom community.
In the field of ESL, we're always impacted the most by pandemics. Our enrollment goes down because international students can't come to Canada, and we lose our jobs. So basically, ESL teachers, we're in a field of work where anything that happens restricting international travel we are some of the first people to lose our jobs. And I know that the tourism industries, hospitality industries, airline industries were all also impacted. So it's not just ESL teachers, but because that's the field of work that I'm in, I'm very aware of how a pandemic is going to impact my field of work.
We went from 4 teachers to 16 more, so we had 20 teachers altogether. So we had to train new teachers and how to do distributed learning. We had hundreds of parents that we had to try to help and teach how to do distributed learning, and we had to create the packages and get them all out to families. It was a lot. Looking back, we sometimes shake our heads and wonder how we did it all, but we really pulled together and we really supported those families.
I think our greatest challenge as a school was making sure that we didn't lose a student. And I don't mean wandering away from their studies, I meant lose as a person. We work with a vulnerable population, and often this school site is a place where a student feels safest and supported by stable adults that care deeply for them. Without having the ability to come through these doors, we were worried where they'd go, who would support them, who would help teach them. The biggest impact I've seen on students is the inability to play. The inability to be a kid and have access to a space where you can play safely and not feel judged. A place where you can take risks, a place where you can laugh, and a place where you can feel love. For 2 years, that was something that many were missing out. And I think that impacted not only our student population, but that play was an important part of what brought staff into the building and what connected them with kids. So people had to reflect on practice and different ways to engage students. If we couldn't do so through a game of basketball, through playing pool, how can we build a strong, meaningful, caring relationship with the student using new strategies that we're not familiar with?
I think this is, for me, it's kind of been a wake-up call. How are we supporting families? How are we supporting parents? What are we doing to ensure that, our communities and our civil society are functioning well? And I think that this pandemic really, it brought out some of the best in people, and it brought out some of the worst. And so, I think, how do we learn from this, and how do we ensure that mental health issues are out in the open and being discussed and supported, and how do we make sure that children are participating in that process and being supported and educated properly?
And the pandemic really uncovered and brought to the forefront that digital divide. So that lack of access to technology, quick, reliable internet access, all of those things that were barriers for teachers and students before, often in rural areas, really came to the forefront as a significant barrier. Another low point in the pandemic is the ongoing impacts to mental health. but the impacts of the pandemic on teacher mental health have been near catastrophic.
Teens and adolescents were experiencing very, very high levels of stress. And what is required of that is more classroom management. And so the stress is put on teachers to have to deal with outbursts of behavioral responses to anxiety from the pandemic in an online environment. I sensed that students felt very lonely because there were some international students who couldn't go back to their home countries because of the pandemic. So they were trapped in their houses and they couldn't leave. And so they didn't have a community because their classmates, who were some of the only people they knew, they couldn't see them face to face. And so I did see, in the international students that I taught online, a lot of sadness.
COVID affected my studies negatively in that I really had to learn how to form connections with my classmates online and learn all of the material for nursing online, which is really hard because it's a very physical job.
So you really just feel this overwhelming sense of loneliness, sadness, a need for, touching base with other humans, human connection. So all of those things made it very stressful, and it put a lot of burden on teachers to try to alleviate some of that stress in order to make students feel better. And I'm no psychologist, but I think teachers are caregivers too, just like nurses. And I think that we feel a lot of that stress just as nurses do when we're trying to make a student feel better.
The most challenging things at Island Connect Ed during the COVID-19 lockdown was, first was the masks, because students, when they come in, that visual cue of just a smile is so important, and you could see in their eyes that they were really missing that connection. So I know a lot of us, when they would come in, we'd actually go outside and greet them outside because we could take off our mask and actually smile at the students and have that face-to-face. The other difficult thing for us was locking our front door, because we're such a community school, and we love having our parents come in, and we love just being together. Having that door locked and not allowing parents in the door was really challenging.
Public education has been chronically underfunded. I think more funding is starting to go into mental health, which is really good. I think outreach, community-based services are really important. And I think, teaching children mental health literacy at a very young age, having those courageous conversations around mental health, daily functioning, healthy routines, problem solving, emotions, how to deal with them, all of those things. I think the more money we can put in to being proactive and, starting to teach kids at a younger age.
I really think our youngest learners need to learn in person, where they can explore the world and strengthen social emotional skills and interact with others and communicate and build relationships.
There's a lot of students that really have missed the last couple of years, and they are missing a lot of basic fundamental skills that they're going to need in the coming years.
I definitely had to adjust to the way that I learn, and all of our materials like textbooks, online exams were redone so that they could be taken online, as well as our lab classes were different. So instead of being able to come into the lab to practice our physical skills that we're learning, we actually had to do a lot of this stuff at home by ourselves.
We need to do better by our kids. And we need to spend more time with them. We need to talk to them more. We need to get them outside in nature. We need to provide them with caring adults and safe communities.
Announcing that the Government of Canada will not renew the order in Council and will therefore remove all COVID-19 border requirements for all travelers entering Canada.
Okay, so do you feel that it's less stressful now?
Well, I think it's a little even more stressful now because people were kind of holding themselves together during COVID. And then when it was actually over, when everyone could kind of take a collective breath and say, okay, well, so it's kind of over, then everyone is kind of reflecting on their experience and thinking, gee, do I even want to work in healthcare anymore? Like that kind of burnt me out.
Like there's a nursing shortage, there's also a teacher shortage because of the pandemic, because teachers retired or they went on leaves.
I think the first thing I thought was, how long is this going to last? I didn't quite know if this was a temporary problem or it was going to be something that was going to be long term.
I realized I actually kind of missed seeing students, so that to me was a challenge. And learning was not as good online because I didn't know if people were logged in and had left the room.
Graham, how about you?
Well, I was just thinking of expanding on what Sean was talking about there about as an online teacher. At the same time, I was an online student. By April of 2021, it was an online student from there on in, and I noticed that a lot of students, like you described, just didn't turn on their cameras, weren't interactive, and as a philosophy major, that was very difficult, I imagine, for the teacher. Because the whole point of a philosophy major is that it has to be a Socratic discussion where the idea that everybody's talking and there's an engagement.
I feel great that I can still be the person. I'm actually really grateful for my job, for the job that I have. That COVID didn't really touch it, even though I was touched by COVID. COVID didn't touch my job, and so my job had no. I didn't take a hit from it. I actually was able to make more money through COVID.
So we can actually adapt and we can change things, even in really large bureaucracies. We can change things, and the world doesn't fall apart. That was kind of my big takeaway. Is here's a really interesting opportunity for positive change too. And I'm not negating the fact that some people got ill and died and some people are still ill. So I wouldn't put it on the backs of those people. But there is a chance to move forward and do things differently.
My 3 words would be courage, conviction, and hope.
I would describe teaching during a pandemic as building a plane while flying. And those aren't my words. Those are the words of Farhadi and Winton.
I'd refer to a word that belongs to the land that we're on, and a word that was taught to me by our elder in residence. And that word is a Hulkameetnam word, and it's pronounced Ait Squallowin. And Ait Squallowin is good heart and good mind.
Certainly the first one would be compassion. The second one would be growth, and the third one would be resilience.
I come here to remind myself that nature is more important than anything. I can take my mask off. Don't have to worry about everything that's been eating away at me. And I try to come here and just breathe and meditate on the reasons why I live on Vancouver Island.